Morning. I'd like to talk to you about a new initiative that is trying to translate a whole of society approach to preparedness for pandemics and other public health emergency into action in a number of countries in Asia and Africa. So, a brief outline. I'd like to start with where are we now? And secondly, why do we need this whole of society approach? And what is this fancy word, whole of society? Because I've heard it yesterday 2, 3, 4, 5 times in different sessions, but I doubt people really understand or can picture in reality what this whole of society approach in terms of mechanisms and actions and institutions on the ground. And then I'd like to address the question, why do we need to go beyond health? Why do we need to involve other sectors of society like NGOs and private sector and telecommunications and other sectors? Why we just don't keep it to the Ministry of Health? It's a disease. A pandemic is a disease, or SARS is a disease. And fourthly, if I can answer these previous questions, then you may ask, well, this is very good, so how do we implement it around the world in some countries? So this is what I'll try to do. So to start, where are we now? Many of you maybe already forgot about pandemics, as the last pandemic in 2009 was not so severe, and a lot of preparedness that was happening in 2005, 2006, 7, and so forth around H1N1 has been off the headlines. So maybe I need to refresh your mind. But anyway, H5N1 and other types of influenza viruses are still posing a threat, and we cannot say it's less than it was 5 years ago, 3 years ago, 4 or 2 years ago. So where are countries now? Unfortunately, the majority of countries that we're trying to assist still have not updated their plans or have not looked back at their pandemic preparedness plans or public health emergency plans since the 2009 pandemic. And many of them in 2009, when H1N1 was announced to be the first pandemic of 21st century, quickly used track change and replaced H5N1 with H1N1 and said, oh, we have a plan. But really, those plans were not pandemic plans. They were mostly avian influenza, zoonotic disease plans. So this slide is trying to show you where countries are. Majority of countries, these plans are really in the Ministry of Agriculture, Ministry of Health, with some implication of the agencies that are prominently present in this conference, the disaster managers and heads of disaster management institutions. And some countries in the second category, in the middle, 20-30%, they realize that there is something beyond health and they do need to involve other sectors of society, and they maybe devote a little bit in their plans a couple of paragraphs to describe that, but really it doesn't go beyond that. They don't have operational plans. They don't have specific roles for these other sectors of society and other critical infrastructure. So that's not really effective in case of a major severe pandemic in the future. And very few countries, leading countries like New Zealand and Ireland and France and UK and US and others, they really have taken steps to integrate pandemic preparedness into overall disaster management. But these countries remain few, and we have to learn from these countries and spread these best practices to other countries that we're trying to assist. So now back to this whole of society approach. I will try to talk a little bit about this and demystify this fancy word and what it means. And I'm sorry, but this graph doesn't look too demystifying because it's quite complex, and I'll try to simplify that. So it's basically, how did this come about? Basically, a team of my colleagues looked together at many plans, 20 or so plans around the world, the best plans, and tried to come up with the principles, the elements of the most successful plans. So these are the 5 principles of the whole of society. The first one, the whole of society, represented here by these 3 circles in the middle: civil society, business, government. So basically, this principle says you cannot just plan in the government and not involve the private sector, not involve the civil society, because maybe your critical infrastructure services are provided completely by the private sector, like energy or like water and sanitation. So if you leave them outside of this preparedness, your whole country is not prepared. Same for civil society. In some countries in East Africa, South Africa, the social services like health services, 70% by the NGOs and religious groups. And if you don't involve them, then you're just not prepared as a society. The second principle is preparedness at all levels. And this is this pyramids with different degrees of blue. What this principle tries to say is that you may have a wonderful plan at the central level, and it makes sense, and it has all the chapters, but then you go to a district or a village, and you talk about pandemic preparedness or public health emergency preparedness, they have no idea, they never heard about it. So it's important that appropriate levels of effort are being put in place to disseminate this and adapt the central level planning to the lowest level where actions need to take place. And we see this in many countries where they do have quite good and quite wonderful plans at the central level that were put together by various consultants and professionals at the country, but they don't go to the levels where they need to go. The third principle is the attention to critical interdependencies. And this is this circles around this diagram. So no matter what country you are, if you're United States or New Zealand or if you're Malawi, you still have more or less 7 to 12, 15 critical infrastructure services that the society depends on, and these services are very, very, very interdependent. Health sector cannot work without water, they cannot work without electricity. So if they don't involve all the critical infrastructure sectors in planning and make sure that they can continue operating during a pandemic that will disrupt services, that will keep people at home or kill people or make them worried and not come to work without involving all the sectors in the planning, these plans will not work. Number 4, severity-based response. This was exemplified during the H1N1 pandemic. It's important to keep in mind you don't want to overreact and you don't want to underreact. If you underreact, you may kill people. If you overreact, you may kill the economy. So it's important to have systems in place to determine early on how severe you think the event might be, or how severe you already know because you have some data in place. But that's a different discussion because it's very difficult early on in a public health emergency event to know how severe it is. But still you have to scale your response based on what you estimate. And number 5, very important, is respect for ethical norms and making sure that the vulnerable populations are taken care of, they are included in the plans, refugees, migrants, disabled people, and so forth. So again, so why do we need to go beyond the health? Why do we need to involve all these sectors? Is many reasons. And we can talk for hours, but we only have 15 minutes. So just these 3 points to easy remember the 3 big categories of why we need to go beyond the health sector, involve all the other sectors. Number 1 is dependency. The health sector, as I said, is heavily dependent on many, many critical infrastructure sectors. They need drugs, the drugs need to be transported, they need water, they need sanitizer, they need many, many things. So if they don't involve other sectors, they're just not going to be able to function. Number 2, disruption of socioeconomic life. I mean, the socioeconomic life, economy may be disrupted more than the actual health consequences are. And I just want to quickly remind you of the culling of pigs in Egypt in 2009, when they didn't even find the first human with H1N1, but they went ahead and said, okay, all the pigs need to be slaughtered. As a result of that, we had interethnic violence, and we had some consequences that had nothing to do with that virus that was not even detected at that point in Egypt. So we need to prepare for this type of decisions that may not be based on evidence. And we need to plan for this and try to avoid them. And number 3 is development externalities. If we involve you know, we can use this window of opportunity to prepare for a public health emergency or a pandemic and involve all these sectors. But you need to involve these sectors for tsunamis. You need to involve them for other types of emergencies. And if you develop the systems, the mechanisms, the relationships, this can be useful for other types of disasters. Again, a brief slide. I will not spend too much time here. It's the investments. A lot of investments by private sector and public sector and governments was made into medical interventions, vaccines, drugs, protective equipment. Why? Well, this is something you can clearly show to your public and show this is the warehouse, I have it there. When it comes to the civil continuity or making sure the critical infrastructure services will function, it's more difficult to show what was achieved. There is no warehouse. It's all planning processes and plans and arrangements. So I think we might need to reverse this pyramid of investment and put more energy and more investment into maintaining and preparing for civil continuity, making sure that the society keeps running. Again, I will not spend too much time on this, but we are implementing an initiative funded by the USAID, and we're trying to make sure that this whole of society approach is being put into practice in a number of select countries in Asia and Africa to show an example of how this can be done, because of course we hear skepticism and criticism and say, okay, we are not New Zealand, we don't have resources. So we're trying to come up with very simple approaches that are implementable with little resources, and some improvement can be made without major investments. This is the universe of countries at the present moment, and this is the process that we have developed, step-by-step, 5-step process to actually put this approach into practice. So we start with making sure we know all the initiatives that are ongoing in the country. We know the agenda of the government. We know where they're moving. We know what they want to achieve. We see all the other actors that are trying to move in the same direction, and we don't duplicate, we don't replicate, we work in concert with other actors on the ground. Then we organize an event in which we bring all sectors of society, all private sector, NGOs, other actors, and go through a sectoral planning with them and orient them how to move into implementing this whole society approach. Then they have a year in which we assist them and they come up with sectoral plans, and then we help them put this together into an overall coherent national plan. Then we do plan validation, and we end as a culmination with a functional exercise using a special software that involves all these sectors in testing how this plan will work. So thank you very much for your attention, and I think I have 2.5 minutes to answer questions. Thank you.
Represent this triangle in the center?
This is the levels of the government: central, subnational, local government, community.
I mean, this area.
This area?
Yes, what is represent?
The yellow there, the human. One human, yes.
Yes.
Because one person can be actually, you know, part of a government in the morning, and then it can run a private business in the evening. So that's why the overlap. And Michael Moselman here in the second row. Thank you.
No, I'm interested to know how Prepare identified the percentage of countries in each category in the subsequent slide.
Very good question. This is not a scientific analysis. This is based on my and my colleague personal experiences in this area. There is no, as yesterday was discussed in one of the sessions, there are no good tools to measure where countries are. So this is based on a preliminary analysis of a range of tools that are not unified. Different countries use different measurement tools. OCHA had their tracker database. CDC Atlanta, the US CDC Atlanta has 42 countries where they're using one particular measurement tool. scorecard for core capabilities. So I think as a community of pandemicists that maybe are in this Ignite room today, we need to work better into harmonizing and putting all these measurement efforts together so we can have much more accurate and valid numbers. Thank you, Michael.
Any other questions? Like the next presenter is not here, so.
Okay, no, I have another 15 minutes, no presenter.
Does Prepare have a Twitter presence?
We are exploring this possibility, but we are putting next week a Facebook page and a LinkedIn page, so we'll be on those portals.
Out of all the countries that were in the next slide, which country, in your experience, you were just talking about your experience, do you find is the best example of a country that has moved forward on the whole society approach?
From our universe of countries, well, I think countries like New Zealand and Ireland and France and UK have made very good progress. In terms of countries that we're trying to assist, I think we have countries that we can name that have realization that they need to move in this direction. And these are Ghana and Kenya and Cambodia and Laos. So, but it takes more time and resources and follow-up to actually see these changes on the ground. And it's not a quick fix. This cannot be done in 1 month. It's a long-term process, and hopefully this will be helpful not just for pandemic preparedness or public health emergencies, but will improve overall governance of disaster management.